think for new things, like I said, the technology, using that for return to play decisions really helps us because we can really see what percentage this knee is. If they're usually pushing off at 80% of their max and now they're at 60%, we can utilize that, including functional rehab and functional motion into the student athletes' exercises and having the freedom of use for any tools that aren't strict, stable in one place.
I'm big on blood flow restriction. I think that's been the first thing I've seen in a while that really works. You know, we've been seeing some amazing results with it, so I think that's pretty exciting. And I think just the different soft tissue things like the ARTs and the Graston techniques, I think those are really great techniques. Dry needling, even though we can't do it in Florida right now, but that's a concept that a lot of people use and get good results with.
The biggest things we focus a lot on is rehabilitation of concussions, and so with that said, we focus a lot on following an exact protocol and through stages. And with those stages, we implement a lot of light exercises to moderate exercises to exertional exercises. But then we also started implementing vestibulo-ocular exercises as well as part of our rehab to focus on how the eye is moving and how how the inner ear might be affected in the situation. And so by adding those exercises, it's really helped our concussion rehab and just the return to play emphasis. So that's been really good.
I think right now that's in the forefront of athletics and in the media itself. So our concussion protocol is we identify that athlete who may have sustained a concussion or a head injury. And by doing so, we go through an evaluation. Per our protocol, we baseline test all contact sport athletes and collision sport athletes. And we do that with impact, and we also do with our football kids King Devic testing. So we established two different tools of having a baseline. If an athlete is suspected of having a concussion, he is immediately removed from play. He must seek treatment within 24 hours, and it must be by an MD or a DO. If they receive treatment through an emergency room physician cannot clear them, so they do have to see a medical provider. However, in our protocol, we state that they need to see an impact credentialed physician or someone who's been trained to deal with concussions. From that point, if the athlete has gone through that process, they come back to us with their protocols in place from the physician. One of the biggest things we do at the high school setting, we're involved with what we call their return to learn, not so much the return to play as it is return to learn. We send that information to the school, to the principal, to their counselor, and to their attendance clerk, and that gets disseminated to their teachers. Our team physician, who is an impact credentialed physician, every 2 years, biannually, works with our teachers and in services them basically on the protocol and steps in place. So we treat the academic side with those athletes as well, and once they're ready to symptom free and that they can start returning back to some of their schoolwork, and then we start the physical progression and let them return to play once they completed all steps.